I am Marjorie Lee De Leon, a third-year nursing student at University of Technology, Sydney. In this presentation, we will talk about the workplace bullying in nursing. This presentation aims to help the new graduate nurses to increase awareness about bullying in nursing workplace and to help them develop an effective leadership amongst the other healthcare team and patients. The objectives of this presentation are to extend the knowledge and the meaning of workplace bullying to graduate nurses and nurses, to know the impact of bullying to patient safety in nurses' workplace, and to develop the knowledge on how to manage a workplace bullying in nursing profession. First, let us know what is workplace bullying in nursing. It is defined as a repeated of unreasonable interpersonal behavior towards a person by another people in the workplace. Bullying at work can create risk in health and safety of the person being bullied. Bullying incidents may include direct and indirect bullying like verbal abuse, aggression, and unjustified criticism at their workplace. For the background of bullying in Australia, it was measured using Australian Workplace Barometer. In the year 2014 to 2015, using Australian Workplace Barometer, Australia was in the sixth place of the highest workplace bullying compared to the few European countries. According to Potter et al. 2016, there are also 9.5% prevalence of workplace bullying reported within Australia in the year 2014 to 2015. In the nursing context, the conducted survey of New South Wales Nursing and Midwives Association, there were 77% of witnessed nurse bullying in their workplace. It showed that the level of workplace bullying in Australian nursing is unacceptable. In nursing profession, bullying is an issue of a raising concern. The World Health Organization and the Safe Work Australia identified that the increasing presence of the intended and unintended bullying in nursing places the nurses at a serious risk of mental and physical health as well as their safety. One of the factors contributing to workplace bullying in Australian nursing profession is that bullying has been ingrained and become the workplace culture in nursing profession in Australia. Therefore, nursing culture in Australia has been termed as stressful, hostile, and harmful environment to work in. Another reason is the disparity of positions between nurses. It has been considered as one of the reasons of workplace bullying behavior in nursing profession. But bullying does not only happen between the new graduate nurses and the senior nurses, but also to the nurses with the equivalent positions. Bullying is a significant issue to contemporary nursing practice. According to Emerald 2014 research, if the workplace bullying in nursing profession continues, it will continuously affect the work outcome of the nurses. It will significantly negatively affect the nurses' job satisfaction, work management, and occupational stress. It also adds to the shortage of high-quality nurses to care for the patients. Also, in the context of bullied nurses and the new graduate nurses, they were less likely to receive support from the non-bullied nurses. According to research, the first 3 months of the transition of being a new graduate nurse is the most critical stage. Therefore, if bullying continues, it can impede the new graduate nurse's concentration to the complex tasks related to patient's care. The workplace bullying in nursing could also affect the patient's safety. The workplace bullying between nurses could increase the mortality rate of the patient. The patient will feel at risk if there is an unhealthy behavior happening in a healthcare team. The nurses will less likely to ask assistance from the other nurses. This could lead to the situation that the patient will not receive the proper intervention and the quality care they need. By having a hostile and unsafe environment because of bullying, it can be a breeding ground of nurses' error, accidents, poor performance in their practice, and care for the patients. The workplace bullying in nursing could also affect the healthy workplace. The workplace bullying can be profound in the new graduate nurses. New graduate nurses are more vulnerable in bullying as they are lack of experience in nursing practice. If they are being bullied, the consequences of bullying to them include depression, increase of suicidal tendency, low self-esteem, and physical and emotional exhaustion. Moreover, bullied nurses may find themselves less active and has low productivity, as well as experiencing the feelings of anxiety and stress. These feelings could go beyond the nurse's workplace and could slowly affect their lives. It also has an impact that the nurses are unable to trust the employer and their colleagues. The further issues are the difficulty of recruiting new nurses and the significant cost of retraining them. What is being done about the workplace bullying in nursing? In nursing contexts, there is such information, trainings, and supervision provided in order to prevent bullying in the workplace to minimize the health risks. This includes the education programs for the employees and managers in management of bullying. It gives awareness regarding the responsibilities of the nurses in bullying in their workplace. There are also induction trainings provided to the nurses and the new graduate nurses for the management of bullying. Moreover, the information about support mechanism for the victims of bullying are being provided. In the year 2013, Australia's federal parliament approved the changes to the Fair Work Act. They have set new standards and specific provisions under the new anti-bullying law. In early 2014, the changes in the law has been forced, which has enabled the employees who are being bullied in their workplace to apply for a Fair Work Act commission in order to stop the bullying. This will allow the Fair Work Commission to determine the needed protection to the employees being bullied at work. Effective leadership may contribute to mitigate the workplace bullying in nursing. Workplace bullying does not only affect the victims but also the entire organization. For this reason, it is also the responsibility of the other members of the organization to diminish the bullying. Therefore, an effective nursing leadership is the key to the successful modification of workplace bullying in nursing. An effective leader cares about what behavior in the organization will be tolerated and what is the consequence of these actions. Effective leadership in the situation like bullying asserts themselves and intervene into the situation in order to give the appropriate action. Effective leadership also encourages the nurses and other health staff to have a teamwork and create a good socialization, especially with the new graduate nurses. Through this, it could help to promote a positive working environment rather than a bullying workplace. The new graduate registered nurses also has the responsibilities in regard to dealing with workplace bullying. First, the new graduate nurse's responsibility is to check and understand the written policy and procedure of the organization in dealing with bullying. Second, it is their responsibility to understand the standards of care and the code of conduct of nurses. For New South Wales new graduate nurses, the New South Wales health policy regarding prevention and management of workplace bullying has to be followed. These guidelines and policies will help the new graduate nurses in dealing with workplace bullying. The Code of Conduct describes the responsibility of the nurse in relation to prevention of bullying. It encourages to provide a cultural, safe practice and respectful relationship in the workplace. The new graduate nurses should always engage with the people in safe and respectful approach. Based on the Nursing and Midwifery Board of Australia 2019, one of the standards of care in nursing practice should be performed in a professional and therapeutic way. It teaches the new graduate nurses to not engage themselves in bullying actions. Instead, they were encouraged to report any notifiable misconduct like bullying to the supervisor or manager. Therefore, all nurses are encouraged to involve in anti-bullying prevention policies. Fostering a free from bullying nurse workplace, promoting the values of the facility, and promoting the New South Wales health policy regarding bullying will help decrease the workplace bullying in nursing profession. Another responsibility of a new graduate nurse is to educate the peers and the patient about workplace bullying in nursing. Based on the Code of Conduct, Principle 7.1, it is the responsibility of the nurse to promote health and well-being of the colleagues and patients. The new graduate nurses have the responsibility to encourage the co-worker or patient to seek help if they are being bullied. They could advise to seek help from the National Health Support for the nurses to get advice and reduce the effect of bullying in their health. On the Code of Conduct Principle 7.2, it is the responsibility of the nurse to promote health to everyone. Therefore, a new graduate nurses are encouraged to engage in the services and trainings related to workplace bullying as well as participating in continuous professional development program about workplace bullying. This will develop the current nursing practice and share it with their colleagues and patients to promote health and safety. This is the end of my presentation. I hope you learned something about workplace bullying in nursing. Thank you for listening. These are the references that I used in this presentation.